Disclaimer: I am not a doctor or nutritionist. All the information provided is from my own personal experience and experimentation only. So, gout, what is it? Gout is a common and complex form of arthritis that can affect anyone. It's characterized by sudden, severe attacks of pain, swelling, redness, and tenderness in one or more joints, most often in the big toe. An attack of gout can occur suddenly, often waking you up in the middle of the night with the sensation that your big toe is on fire. The affected joint is hot, swollen, and so tender that even the weight of a bedsheet may seem intolerable. Gout symptoms may come and go, but there are always ways to manage symptoms and prevent flares. So the symptoms of gout are intense joint pain. Gout usually affects the big toe, but it can occur in any joint. Other commonly affected joints include the ankles, knees, and elbows. This is where I get it. Started getting it in my ankles. It moved to my knees. It often goes back down to my ankles and my foot. And I have had it in my elbow too. Wrists and fingers. The pain is likely to be most severe within the first 4 to 12 hours after it begins. Lingering discomfort. After the most severe pain subsides, some joint discomfort may last from a few days to a few weeks. Later attacks are likely to last longer and affect more joints. Inflammation and redness. The affected joint or joints become swollen, tender, warm, and red. Limited range of motion. As gout progresses, you may not be able to move your joints normally. So I found this is true with my knee specifically and my ankle. So I'm not able to bend when I get at my knee. I'm not able to bend my leg at all. If I am to bend it at all, it feels like someone is like getting a handful of glass and rubbing it and grinding it on my joint. It is excruciatingly painful. I was howling and crying in pain with this recent bout and the last one that I had on my knee as well. You get into situations where you may need to go to the toilet, do a number 2 or whatever it may be, and you are not physically able to move your leg anymore. It's almost paralyzed. Your body has a way of trying to keep it still. So if you try and move it, it is absolutely excruciating. Okay, so what is the cause of gout? Gout occurs when urate crystals accumulate in your joint, causing the inflammation and intense pain of a gout attack. Urate crystals can form when you have high levels of uric acid in your blood. Your body produces uric acid when it breaks down purines, substances that are found naturally in your body. They're also found in a lot of food, especially meats, and some plants. Purines are also found in certain foods, including red meat and organ meats, such as liver. Purine-rich seafoods includes anchovies, sardines, mussels, scallops, trout, and tuna. Alcoholic beverages, especially beer and drinks sweetened with fruit sugar, fructose, promote higher levels of uric acid. Normally, uric acid dissolves in your blood and passes through your kidneys into your urine. But sometimes either your body produces too much uric acid or your kidneys excrete too little uric acid. When this happens, uric acid can build up, forming sharp, needle-like urate crystals in a joint or surrounding tissue that cause pain, inflammation, and swelling. Now, the risk factors. You're more likely to develop gout if you have high levels of uric acid in your body. Factors that increase the uric acid level in your body include diet. Eating a diet rich in red meat, shellfish, and drinking beverages sweetened with fruit sugar, fructose, increases levels of uric acid, which increase your risk of gout. Alcohol consumption, especially of beer, also increases the risk of gout. Weight. If you're overweight, your body produces more uric acid and your kidneys have a more difficult time eliminating uric acid. Medical conditions. Certain diseases and conditions increase your risk of gout. These include untreated high blood pressure and chronic conditions, such as diabetes, obesity, metabolic syndrome, and heart and kidney diseases. Certain medications, low-dose aspirin and some medications used to control hypertension, including thiazide diuretics, angiotensin-converting enzyme inhibitors, and beta blockers, can also increase uric acid levels. So can the use of anti-rejection drugs prescribed for people who have undergone an organ transplant. Family history of gout. If other members of your family have had gout, you're more likely to develop the disease. So in this case, my dad had it. He was a heavy drinker, heavy smoker, ate whatever he wanted, and didn't look after himself. So I inherited that. Thank you, Dad. Age and sex. Gout occurs more often in men, primarily because women tend to have lower uric acid levels. Men are also likely to develop gout earlier, usually between the ages of 30 and 50, whereas women generally develop signs and symptoms after menopause. So I started getting gout in my late 20s. I had an IT job, which involved a lot of sitting, and I also particularly like gaming. So I started getting gout in my feet. I had no idea what it was at the time, but I was just up working on some computers, standing around, standing desk, pulling a computer apart, and my foot was just more pain, just pain, radiating, swelling, aching, and just got worse and worse and worse. I had no idea what it was. Um, when I finally realized, I started to walk and ride to work instead of driving to get the blood moving, to start losing the weight, get the blood moving. Because I would go to work and I would sit, and then of course my hobby is gaming, so I would come home and then sit again. So that's a whole nother issue. But basically, fluids pool in the legs and the feet, and that can also cause issues as well. Also, really bad for blood flow. We'll get into that later. Okay, so how do we prevent gout? I'm going to go over the things that's recommended. I'm going to go over the things that I've actually done as well to help prevent the gout flare ups that I get. So here we go. Some people with gout experience recurrent attacks, which may be prevented by using prescription medicines. These medicines work by lowering uric acid levels in the blood. The most commonly used medicine is allopurinol. This helps to lower uric acid levels by reducing the body's production of uric acid. You can also reduce your chance of having further attacks of gout by adopting some lifestyle changes, such as reducing alcohol intake, in particular avoiding binge drinking, gradually using weight if you're overweight while avoiding fad diets, eating a healthy, balanced diet, drinking plenty of water, especially when at risk of dehydration, such as when you are sick or traveling on a plane. Now, of these things that I have done to prevent my gout is this. I stopped drinking alcohol completely. I haven't had alcohol for almost 2 years. I have started to lose weight. However, this is a dangerous one. This right here. Most of the gout attacks that I have gotten is from dropping weight too fast. Now, there is a reason for that. What research confirms fasting causes gout? Yes, fasting can cause gout. Hyperuricemia, or excess of uric acid in the blood, is well known outcome of starvation or fasting. When the body cannot remove uric acid, gout will strike. Here are some supporting studies. So since 1924, several research studies concluded fasting will cause uric acid levels to rise. Several studies under different test parameters, from total fast to intermittent fast, indicate uric acid levels rise in 2 to 14 days. So an Australian university weight loss study in 2019 collected patient data for fasting for 2 days and continued with regular eating for 5 days and repeated the cycle 3 times. The outcome confirmed a drastic increase of uric acid levels, blood pressure, and body temperature after the first cycle, 7 days. An extensive Japanese study published in 2019 involved a 58-hour fast analyzing several metabolic factors. Results per gout indicate a drastic increase in purines and uric acid, especially during the first 34 hours. So why does fasting cause gout? When you go on a weight loss diet, your body needs time to adjust to the new low-calorie or reduced food intake. Several metabolic processes or biological reactions from fasting cause gout. Blood sugar decreases. The first source of energy the body will use is the available glucose sugar from food. Hunger signifies your body has used up the glucose from recent food and needs to find more glucose elsewhere. Since carbohydrates from food are stored as glucose, so carbohydrates break down to something called glycogen. Glycogen is then broken down and stored as glucose. Eating fewer carbohydrates will also lower the glucose level in the body. When the blood runs out of current glucose supply, the body will use the second energy source, which is stored fat. This is why weight loss diets always require eating less sweets and carbohydrates. In addition, low blood glucose is a critical element in why gout occurs from fasting. Ketosis restricts uric acid excretion. The second metabolic process while fasting is called ketosis, when the body starts to use fat for energy, depending on the individual's health, lifestyle, and diet program. It can take 2 to 14 days to reach ketosis. Burning fat makes acids called ketones. During this process, ketones can build up in your blood. The excess ketones can alter the chemical balance of your blood and disrupt your entire system. Research studies indicate ketones cause many enzymic activities throughout the body. Per Gout, ketones change the biochemistry in the kidneys, where uric acid becomes less soluble and harder to pass into urine. Instead of removing the normal amount, more uric acid stays in the blood. Whenever your body reaches ketosis, the accumulation of ketones in the blood restricts the ability of the kidneys to filter out uric acid. The excess uric acid in the blood eventually accumulates at a joint to cause gout. Okay, so here are some pictures of my recent attack. So it started in my knee just over 2 weeks ago. It was actually weird because I had a dream that I was lifting weights and doing heavy barbell squats and dumbbell lunges. And I woke up in the middle of the night. I had pain in my knee. And then the next day, couldn't walk, right? So you can see the swelling in my knee as it stands there in the photo. And as a comparison, this is the swollen one here, and that's the other one. So you can't even see my kneecap really on the side here. It's just engulfed the whole leg and my quad. And so with me, my gout always seems to shift to my calf, my Achilles tendon, and my feet, like around my feet and ankles. So you'll see on this photo here, you can see my Achilles tendon really clear here, but here, look how fleshed out my ankle is. So at this point here, I got my wife to take a photo because this state of gout, when it's like this in your Achilles tendon, it felt like someone was holding a lighter, actually a flame, to my ankle. That's how sore it was. And then it shifts down to my feet. You can see this weird discoloration around my the side of my foot here. And I still have gout as it stands right now as we speak, and I can feel it in between all these bones here. Metatarsals, tarsals, metatarsals. Obviously can't walk still. And I can't really sit that long either because it cuts the blood off. And then here's one of my ankle, that's my ankle bone. You can see it's just blown out. And there's like lots of little patchy dots of like red dots on the skin. And so I looked up what that was, and that's lack of blood flow as well. So with that being said, what have I done to prevent it? So these are the steps that I've taken, what I think caused the attack. So first of all, I stopped drinking. Almost 2 years since I've had any alcohol at all. I stopped eating takeaway. You guys call it takeout in America. I stopped eating meat, almost all meat. I stopped eating red meat. The only meats that I eat now, or the only protein really that I get, is egg. And occasionally I have fish, but it's not that often. It's like maybe once every 2 weeks to a month I'll have fish, but I try and have egg every day for protein. I only have 2. All the rest of what I consume is plant-based, most of it anyway, because I have milk and stuff like that. Like I'm not full vegan, but mostly plant-based stuff. Anything with high purines in it, I do not touch it. I don't even look at it now. No, thank you. I started walking. We'll get to this in a second. I started walking. I could even run. And since the last gout attack, I'd say it took probably 10 months for my joint to recover from the damage that it caused. 10 months. Right? And so I started walking and I could even run. Where do I think it went wrong? Let's see. Where it went wrong. Okay, so I've been really trying to boost the YouTube lately. So I've been sitting a whole lot more than I should be. And so I stopped walking. I still exercised, but I did not do cardio. And that's the key. We'll get to that in a sec. I ate a 12-piece chicken nuggets. I ate a 12-piece chicken nuggets. My son had a birthday. We ended up getting HJs. We call it Hungry Jacks. You guys call it Burger King. And I thought, just chicken. It'll be fine, just for the one-off. So I had the 12-piece nuggets, right? The other thing that I did was I ate Vegemite. Why is that a bad thing? It's full of yeast, full of salt. Yeast is full of purines, like high in purines, which means it's high in uric acid. So stay away from Vegemite. And I also ate a lot of bread. Why is bread bad? Same reason. Sugar. Sugar causes inflammation in general. And yeast. Oh yeah, that's the other thing I'll add too, is over here, I stopped eating sugar. Like, I do not eat any sugar at all. If I want something sweet, I eat dates, I eat stevia, and I have maple syrup. I don't touch sugar at all. So yeah, these are the main things that went wrong. Stopped walking, ate the wrong kind of food, I ate Vegemite, I ate bread, with lack of movement. And so what I've found, this is how my body feels. This is not scientifically backed. This is my experience now. So basically, the way I see it is, if you have a pond, say it's a creek or something, right? And you have flowing water to it, right? Flowing water, and it comes from, I don't know, pipe or whatever. Hey, whoa. Right? It's coming and flowing, it's free flowing. You sit down, you stop moving, right? You sit down, you stop moving. This is what I think. This is what happened to me. I am pretty convinced this is what happened. So, sitting, no blood flow, you get pinched, and this is cut in half. Just imagine that's my butt cheek, right? Let's do freeform. Alright, let's delete that. So now, the water supply starts getting cut off. And it's not flowing. It's now one stream. So what I think happens is, this water starts to get dirty. It changes color. Right? Changes color. So basically what I'm saying is, lack of movement causes your veins and arteries, everything to close up. And the water, like your blood goes through, it pools in your feet and legs. It gets dirty. It's not getting washed properly because there's less activity in the kidneys. Your heart's not pumping hard. It's not pumping the blood around. The water, say blood, becomes stagnant and dirty. And you're not processing everything that needs to be excreted from the body. In this case, uric acid. So, what's my plan for this next bout? First of all, I want to drop weight. And I don't just mean fat. I mean all weight. I want to basically become half of what I am right now. And I probably weigh, I don't know, I haven't weighed myself in a while, but last time I weighed myself, I was about 104 kilos. I want to be 30 kilos lighter than that. 20, 30 kilos lighter. And I need to do a lot more cardio. And I need to make that a priority. I wasn't making cardio a priority. I was making it, if I have time in the afternoon, then I'll go do it. If I have time in the afternoon. Imagine treating your body that way. You know what? Like, looking back on it, I kind of deserve it because I wasn't taking care of myself as well as I should have. But anyway, I hope this helps. I hope you learned something. I hope that you guys can manage your gout a little better. I mean, I'm sure everybody does the usual stuff like icing the joint, and I take ibuprofen. That's the only thing that gives me relief, and ice. I have a big thing of ice on my foot right now. I'll just grab it now. I'll show you. Oh. That's just full of ice, and I have that on my foot right now, and my foot's sitting on a cushion because it's just agonizing to have anywhere else. But yeah, it's not nice. So anyone else who is suffering from gout, I feel for you. I'm sorry that you have it. But yeah, they're my my tips for getting better. Like for you have to be very strict with diet. You need to move and you need to do a lot of cardio. Drop the weight, not too fast though, because you'll get gout again, which sucks. So you got to lose it incrementally. So what's recommended for gradual body fat loss is a 500 calorie deficit. But like I say, I'm not a nutritionist. Go and talk to someone about it. Maybe they can give you some meal plan or something like that. And yeah, catch you guys later. Thanks for watching.